Let's discuss one important question. Why Honda Perinux superior to LMWH or unfractionated heparin? Because it is has long T-half subcutaneously given and daily one dose needed. And most important, do not cause heparin-induced thrombocytopenia. Let's see the side effect of warfarin. ওয়ারফেরিন কি করে? ওয়ারফেরিনের আমরা মেকানিজম অ্যাকশন জানি, দ্যাট ইজ দ্য ভিটামিন কে অ্যান্টাগনিস্ট। ফর ওয়ারফেরিনের জন্য টার্গেট আইএনআর হচ্ছে 2 থেকে 3। আইএনআর মিনস পিটি বাই পিটি, স্ট্যান্ডার্ড পিটি প্লাস পেশেন্টের পিটি। ডোজ কি? ডোজ হচ্ছে 5 মিলিগ্রাম, ইনিশিয়ালি 5 milligram per day is started, then dose is increased or dose is decreased according to response. What is side effect? Side effect increase blood report, according to blood related, that is the bleeding risk increase, or according to not blood related, that is the hair loss or coronary calcification. These are side effects. Let's discuss one important thing. We should look for the maintenance of this INR. If this INR 2 থেকে 3, 2 to 3, then patient is okay, and we'll do the 12-week one test per 12 week. প্রতি 12 উইকে একবার টেস্ট করো। আর যদি 2 থেকে 3 আইএনআর আছে বাট ব্লিডিং has started or bleeding increase, in that cases we should evaluate the patient whether patient is using any fish oil or alcohol or vitamin K, because these all things have antiplatelet activity, and due to this antiplatelet activity patient has still INR is 2 to 3, but patient has high chance of bleeding. Let's discuss if patient has INR less than 2 despite use of the warfarin. In spite of use of warfarin, patient has less than 2 INR. Then you will suspect whether patient has taking green vegetables or rifampin. So whether patient has rifampin or green leafy vegetable, then patient has if the patient has INR less than 2, then what are the possibility? Patient either taking the green vegetable inhibit the vitamin K, or patient is taking the antibiotic, that is a rifampin. Suppose patient INR is greater than 3, but you are decreasing the dose of warfarin or anticoagulant, but still patient INR is greater than 3, then what are the possibility? Either patient is taking antibiotics, that is the antibiotic inhibit the vitamin K, or patient is taking acetaminophen. If patient has unexpected high INR, then what will do? You will decrease warfarin. Obviously you will decrease the warfarin, and next step you will give the vitamin K administration tablet vitamin K. So whether INR is not controlled, whether INR is not controlled, when an INR is not controlled, you should evaluate the case whether patient is taking any vegetable or medicine, or patient is whether patient needs vitamin K. Suppose after warfarin therapy or anti-warfarin therapy, patient present with bleeding, what will you do? You will do give FFP or prothrombin complex concentrate, prothrombin complex concentrate, or you may give recombinant factor 7A. These are the therapy for having patient have the bleeding after using the warfarin. Then for how many days warfarin is given? According to ACCP 2012 guideline, if em- patient have the pulmonary embolism due to any provocation, either by surgery or any risk factor, we will discuss about the risk factor. You will give it is for 3 months. Or in case of unprovoked, in which cases the cause is not detected, in that cases you give greater than 6 months or more. Actually, decision about the continuous or stopping should take on patient compliance or response. পেশেন্টের রেসপন্স অনুযায়ী আমি ডিউরেশনটা ডিটেক্ট করব। পেশেন্টের যদি ভালো হয় তাহলে কন্টিনিউ করব, যদি পেশেন্ট রেট করে কন্ডিশন আইএনআরে যদি বেশি হয় তাহলে ডোজ কমাবো, যদি আইএনআর কন্ট্রোল থাকে তাহলে স্টপ করে দেবো। পেশেন্টে ক্লিনিক্যাল ইভ্যালুয়েট করে আমরা ডিউরেশনটা জেনারেলি ডিটেক্ট করি। So if anticoagulation is needed more than 3 or 6 months, then we call it extended duration anticoagulation. What are the drugs for this extension? One is warfarin, second is aspirin, third is LMWH, fourth is rivaroxaban, fifth is dabigatran. These are the drugs we may use for extension. For extension, duration is needed in case of recurrence. Why this extension is needed? Because due to the recurrence. Recurrence of embolism or thrombus is high in case of a patient have any DVT or pulmonary embolism. So in case of recurrence of this case, we may extend the duration. Whether we can detect the recurrence, whether patient and whether this case will be recurred after a few duration. Obviously, we do the D-dimer. If D-dimer increase, then we will suspect patient may have the recurrence. Let's discuss about the risk factor. What are the risk factor? Risk factor, one of the most important risk factor is age. If patient has more than age, advanced patient have symptoms of disease. If patient have any personal family history, patient has surgery history, If patient have any acute infection, if patient has chronic inflammation like IBD, if patient has chronic kidney disease, if patient has long air travel, if patient has pregnancy and using the OCP and postmenopausal hormone replacement therapy, patient has high risk of this development of embolism, whether patient any pacemaker using or implantable any defibrillator or any using of the central venous catheter indwelling central venous catheter, this chance of embolism is high. And last on the hypercoagulable state. In these cases, patient have high chance of venous thromboembolism. Let's discuss about the one important thing, that is the paradoxical embolism. This paradoxical embolism usually is paradoxical embolism may manifest with sudden stroke, which may be misdiagnosed as cryptogenic. The cause of DVG emboli is to the arterial system. That is paradoxical embolism means the embolus enter the arterial system and that it cause the stroke. What is pulmonary infection? That is mainly the pleuritic chest pain happened in case of pulmonary infarction. What is non-thrombotic pulmonary embolism? Whether embolism uh, is happened without any thrombus, obviously it is due to the fat, tumor, or air or amniotic fluid. We'll see the PACE score. What is the PACE score? This is the PACE criteria. This is on the simplified PACE criteria. We, these include the age, history of cancer, history of heart failure, any lung disease, heart rate if greater than 110, non-systolic blood pressure less than 100, or arterial SpO2 is less than 90%. Total 6 criteria included in this basic criteria, and every point has 1 point. If patient has 0 point, then patient has no risk. If the patient has less than or greater than 1 or 1 or greater than 1, patient has a high risk.